Anabolic steroids, a synthetic steroid hormone that resembles testosterone in promoting the growth of muscles. These hormones are used medically to treat some forms of weight loss and illegally by some athletes and others to enhance physical performance. Anabolic steroids can be traced back to as early as the 1930s, before the term steroid was even used. In the 1930s, a team of scientists was able to help create synthetic form of testosterone to help treat men who were unable to produce enough of the hormone for normal growth, development, and sexual functioning.
Some of the street names are Juice, Jim Candy, Pumpers, Andro, and Stackers. How it affects your body is men, they develop breasts and baldness, impotence, and prostate gland enlargement. Women, they get a deeper voice, increased body hair, baldness, infrequent or absent periods. So like the men turn to girls and the girls turn to guys, I guess.
The legal consequences of this drug is the first misdemeanor is punishable by imprisonment for no longer than 90 days, or a fine that is no more than $100. The second violation is a felony and is punishable by imprisonment for no more than 4 years, or a fine of no more than $2,000. People can use these drugs by pills and injecting them into muscles. These doses may be 10 to 100 times higher than the doses prescribed to treat medical conditions. They also have made a gel and cream that can be rubbed on the skin that has the same effects. People who use the anabolic steroids are often bodybuilders, athletes, and fitness buffs who are normally men around the age of 40 who claim steroids give them a competitive advantage and or improve the physical performance. Steroids are purposed to increase lean body mass and their strength and aggressiveness. Steroids are believed to reduce recovery time between workouts, which makes it possible to train harder and thereby further improve their strength and endurance.
Cardiovascular system. Enlarged heart, increased risk of heart attack. There's high blood pressure and blood clotting disorders. Where people get the drug from is doctors may prescribe steroids to patients for legitimate medical purposes, such as loss of function of male genitalia, breast cancer, low red blood cell count, delayed puberty, and states resulting from surgery or sickness. The most common illegal source is from smuggling steroids into the United States from other countries such as Mexico and European countries. Smuggling from these areas is easier because a prescription is not required for the purchase of steroids. What percent of students use this drug in the last month? 30% of 8th and 10th graders and 70% of 12th graders.
This drug can be addictive. However, it's different compared to other drugs because users don't become high when they use it. However, they can experience withdrawal symptoms. When they stop using steroids, people can experience uncomfortable symptoms such as feeling depressed, mood swings, feeling tired or restlessness, loss of appetite, being unable to sleep, and desire to take more steroids. Depression can be very dangerous. It sometimes leads people to think or attempt suicide. These drugs affect many relationships. Studies have shown that large doses increase people's irritability and have shown signs of being physically aggressive towards their family or partner.